Abdominal bloating and distension are among some of the most prevalent gastrointestinal complaints that clinicians treat, and yet they can be frustrating to both clinician and patient alike. Stick around to learn more. Bloating and distension are some of the most common gastrointestinal complaints reported by patients and are more common in women than in men. In fact, bloating and distension are reported in up to 96% of patients suffering from irritable bowel syndrome and in 20 to 30% of the general population. When bloating is not the result of underlying disease such as cancer, hypothyroidism, diabetes, or bowel obstruction, we call it functional abdominal bloating, or FAB. By bloating, we mean the subjective sensation of abdominal pressure without an increase in abdominal size. By distension, we mean the same subjective sensation but with a measurable increase in abdominal girth. The causes of functional abdominal bloating are not fully understood, but several theories have been proposed, including hypersensitivity of the bowels and the organs, abnormal reflexes in the abdominal wall and in the diaphragm, a diet high in fermentable carbohydrates that are poorly absorbed, high fiber diets, and alterations in the gut microbiome. FODMAP is an acronym for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are slowly digestible or indigestible short-chain carbohydrates in the diet that are poorly absorbed and that are delivered to the bacteria in the distal small bowel and large intestine, where the bacteria rapidly ferment them to form hydrogen, methane, and carbon dioxide gases. FODMAPs also draw fluid into the bowel lumen through a process known as osmosis. Patients who follow a low FODMAP diet report a 50 to 82% decrease in bloating symptoms. Air and gas may build up in the bowel by swallowing of air or by the production of gas by bacteria living in the large and small bowel. An overgrowth of bacteria in the small bowel or an alteration of the types and numbers of bacteria living in the large bowel may change the gut microbiome in a process known as dysbiosis. As a result, the bowel may become colonized with new varieties of gas-producing bacteria, leading to increased gas production or decreased gas absorption and bloating. However, an abnormal buildup of gas in the bowel is not always present in patients experiencing bloating when compared with healthy patients. This suggests that hypersensitivity of the bowel wall, as well as an abnormally high awareness of the bowel contents, may be underlying causes for the sensation of bloating. Besides gas production, bowel bacteria can ferment bowel contents, causing the formation of short-chain fatty acids, which can increase the motility and sensitivity of the bowel wall. Sometimes abnormal muscle reflexes are found in patients suffering from functional abdominal bloating and distension, in which the abdominal wall relaxes and the diaphragm contracts after the consumption of a meal. These abnormal reflexes can redistribute bowel gas, causing protrusion and visible distension. Constipation may cause a buildup of stool in the rectum, which may prevent the evacuation of gas and slow the passage of bowel contents. Patients have also reported bloating after rapid weight gain, and their symptoms have resolved after they lost weight. There is some evidence that psychological conditions such as stress may contribute to the increased perception of bloating. Indeed, many patients who experience bloating suffer from anxiety and depression, and treatment of those may provide some relief. Bloating is not always a benign condition, and patients with a family history of ovarian or breast cancer or who have had recent changes in menstruation should have a pelvic ultrasound. Patients over the age of 50 with recent onset bloating should have a colonoscopy, and patients with a family history of celiac disease should be screened with blood testing. The presence of alarm signs such as weight loss, rectal bleeding, or anemia should be investigated immediately. Because the causes of functional abdominal bloating are poorly understood, there are myriad treatment modalities in use. Besides a low FODMAP diet, restrictions on lactose and other poorly absorbed carbohydrates may be helpful. Clinicians have prescribed pro-motility and pro-secretory medications, as well as probiotics, antibiotics, and antidepressants, and have used cognitive behavioral therapy, hypnotherapy, and biofeedback therapy. Probiotics containing Bifidobacterium lactis have decreased bloating in non-constipated patients suffering from functional gastrointestinal diseases. The combination of simethicone, activated charcoal, and magnesium oxide significantly reduced bloating in patients with functional dyspepsia, and there's emerging evidence that kiwi fruit may be effective in the treatment of constipation and bloating. In one study, peppermint oil significantly decreased distention compared to placebo. All in all, a low FODMAP diet remains the most effective treatment option for functional abdominal bloating and distension, and there are smartphone apps that patients can use to differentiate between low and high FODMAP foods. It is important to remember, however, that a low FODMAP diet is not entirely harmless, and it should only be undertaken under the supervision of a trained dietitian. If you enjoyed the video and found it useful in any way, share it with your friends and family, and support the channel by liking the video and subscribing. Until we meet again, thanks for watching.